Hi, I'm Meredith Harris at New Life Aesthetics with Joni, and Joni is just about ready for a treatment with microneedling and PRP. So microneedling is a fairly unique kind of mechanical disruption to the skin that offers a very nice resurfacing. The resurfacing technique with microneedling is collagen stimulating. So we call it collagen induction therapy, and it's a really minimally invasive, low downtime procedure that offers really beautiful results. It can tighten pores, it can help with fine lines, with just tactile or finger touch roughness to the skin that happens with aging, and just general brightening. And then PRP on top of that is the idea of using the patient's own platelet-rich plasma. So I've already drawn a small tube of blood from Joni's arm, and we've spun it in the centrifuge, and now we're going to be injecting it along with using it on top of these tiny little channels or wounds that we're creating in the skin. So I've pre-numbed Joni for this treatment. It's really important that the clients be comfortable in practice, so I make sure that I use a very strong numbing agent, hence the reason why her face is a little red right now, and she feels a little rubbery, but she's very comfortable. It's just hard to smile and interact when you're that numb. So we are going to be treating the face and the neck. We'll start out with microneedling, and as I'm microneedling, I'm actually going to be applying the serum that I've drawn from her directly into those little tiny channels or wounds that I've created. So if I have a young person with very fresh acne scarring, or if I have any particular younger skin needs, I can address those with less depth. When I'm dealing with older acne scars, I really need to go deeper. I can also go deeper for more of the wrinkles that form with age. It will be as aggressive as she can tolerate, and that puts us to a depth of about 2 millimeters, which is just into the epidermis. And then we're also going to be applying her platelet-rich plasma. I've already drawn it into syringes, and you'll see me applying it during the application process. The yellow serum is what we've drawn off of that tube of blood that I drew earlier, and that serum is just forced down into the little channels. And then afterwards, when we set her up, I'm actually going to inject some of that directly into the crepey little fine lines in the areas that are of concern to Joni. PRP really helps to brighten the skin. So what we'll see is an accelerated collagen synthesis process, but it also helps to brighten the skin so that the skin looks more youthful and has a prettier glow to it. So let me go ahead and get started. I'm going to apply a little PRP. She may feel a little liquid on the face here. All right, turn this on, Joan, and you may start to feel kind of just an annoying vibrating sensation. You okay with that? Mm-hmm. Not uncomfortable?
No.
Okay. So with microneedling, typically we'll want to see some pinpoint bleeding. And though we're not directly treating pigment, you will find that pigment lightens and brightens with time. So this is exactly what we wanted to see. You'll see the skin get pink, and you'll see these little tiny wounds, if you want to call them that, created. And then they seal within that first hour after treatment, and they lock in that really nutrient-rich PRP, which is full of growth factors, stem cells, all the good stuff that our body makes to help us generate collagen. More than anything, she's probably feeling more of an annoying kind of vibrating feel to it.
Yeah, it feels like a deep, vibrating massage kind of.
All right, Joan, I'm going to have you face straight up for me. Perfect. Now we'll be doing sort of more of the mid face. So I'll start with the chin here, applying a little PRP there. And same idea here. Still fairly comfortable. Mm-hmm. Starting to see those little pinpoint spots come to the surface here, and that's great. We'll go back and put a little more PRP in there at the end. As I told Joni earlier, when she goes home, you're not going to want to wash your skin after treatment until that evening, so just leave the PRP on the skin, and as it dries, it's going to kind of look a little crusty and feel tight, and that's completely normal. If this is too much, just let me know, Joan. As the skin is healing, I always recommend that we use a combination of a really good hydrator, because this is, though it's mechanical, it's not a chemical peel, you do tend to see some healing time in the sense of just having really sort of dry, peely kind of skin. Not major peeling like chemical peels, but certainly a little flaking. So I'll get them to use a really good hydrator. And we also have growth factor based products that are medical grade in the office here, and I highly recommend those for healing because they increase the healing capacity of the skin, and they really help with the process of collagen synthesis. And generally speaking, tomorrow the skin won't look red. She might have a couple little spots that look a little like a little abrasion, a rug burn, something like that, but the PRP really accelerates the healing time nicely. So tomorrow she could really go without makeup if she wanted to. Very typical area around the eyes to be of concern for both men and women, and we often treat with Botox in this area for the dynamic wrinkles, but too much Botox can cause puffy under eyes, so it's really nice if we can complement it with a little microneedling treatment. And I've saved some aside for your injections. The PRP to be injected is extremely safe. There are no side effects from it, no risk factors with it. Use a tiny little insulin needle, and it really improves the quality of the look of the skin. So Joni's just undergone a treatment with microneedling and PRP, and now I decided I think it'd be really in her best interest to take some of the PRP and inject it directly into some of these deeper wrinkles and folds and any areas that I think just need a little extra rejuvenation. So again, it's to work on collagen synthesis and just to give her a prettier look to the skin. That glow will certainly be evident after treatment. All right, Joan, so yeah, I'm gonna have you turn. Perfect. And you'll see the wrinkles actually look worse initially after PRP and microneedling, just simply because that PRP dries on the skin. The numbing agent keeps them a little more comfortable too. So I'm confident that tomorrow she may have a little bit of swelling under the eyes. She may have a little bit of swelling of the neck area. That's very common areas for swelling. She may experience a little redness tomorrow as well as tonight. She just looks like she has a pretty moderate sunburn right now, and she looks dry and sort of tight. And that dry and tight look is just strictly because of the PRP. The PRP injections don't usually cause any bruising. If anything, it might be a little tiny pinpoint bruising where the needle went in, but we use tiny needles to avoid that as much as possible. Sun protection, growth factor based products and hydrators, moisturizers are excellent. I just ask that they not do anything with their skin the night after treatment. Tomorrow morning, she definitely needs to wear a sun protection and a good moisturizer. So with that, thank you so much, Joni, for the opportunity.
You're welcome. Thank you.
And thank you for tuning in to New Life Aesthetics.